Have you ever just woken up one day with a swollen toe, finger, knee, or even elbow? Chances are you might have gout, a common type of inflammatory arthritis. Gout is common in the Philippines. In fact, according to the Philippine Rheumatology Association, gout affects more than 1.6 million Filipinos. But what exactly triggers it? On the program today, we'll debunk some of its myths about gout, its difference from pseudogout, its symptoms, as well as its treatment and prevention. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk on CNN Philippines. To help us through this topic on gout, with us is Dr. Givenchy Marie Garcia Bonifacio. She's a rheumatologist from the Medical City. We also have Dr. Dave De Castro, who is a physical and rehabilitation medicine specialist from the Bernardino General Hospital. Gout is a oftentimes painful and acute onset of arthritis caused by the buildup of uric acid, or a normal waste product in your body, in the blood. So when uric acid is elevated in the blood, it can accumulate, form crystals in your joints, and trigger an inflammatory response that causes symptoms of pain as well as swelling. Let's debunk some of the myths about gout. So that's where we'll start. And I'll start the conversation with Dr. G. So a lot of people talk about gout and they look at diet specifically. Gout is caused by kinakain mo. Kinakain mong beans, munggo, maybe yung beer na iniinom. But let's talk about first what causes gout. Let's talk about hyperuricemia for that matter. Can you talk about that, Dr. G?
Gout actually happens because of the uric acid accumulation, like you've mentioned. Certain people that are genetically predisposed to having gout. The diet also contributes to it. If you binge drink, especially beer, and if you eat purine-high foods like red meat, you can be predisposed to having gout also.
So, Dr. Dave, I'd like to ask you, let's talk about that. Let's talk about uric acid. Ano ba ito sa katawan natin, and why does gout happen kapag hindi natin ito na ilalabas ng mahusay?
Uric acid is a waste product of our protein metabolism. So, when a patient is eating too much protein, the protein breaks down, and usually the uric acid is excreted in the urine. If the patient is unable to excrete the uric acid in your body, they usually deposit the uric acid crystals deposit on the joints, mostly on the big toe. That's the most common area of gouty attack, sometimes the ankles, the knees, in severe cases, the elbows and the hands. It's because the patient, most of the time, they are overproducers, or they consume protein, so the body isn't able to get rid of the uric acid.
Now, Dr. Dave, you make a point there. It's the excess intake of protein, for that matter. That's why a lot of people may think that those who are affected with gout are those who are only overweight, yung matagal ng mabigat. Hindi ba pwedeng magkaroon ng gout ang isang payat?
Gout is a chronic disease. Most of the time, it's genetically acquired.
Mm-hmm.
But then, most of my patients, almost 9 out of 10 of my patients, they are mostly overweight because they consume too much protein. There's also the lamang loob, the isaw, and the papaitan and all, and they drink lots of beer and alcohol. So most of the time, I think in my practice, 90% of my time, they are overweight and mostly obese.
Now, let's talk about consuming certain things. Specifically, a lot of people know or are aware that consuming beans, for that matter, can trigger gout. Doc G, pag-usapan natin, sinabi nyo kanina, binge drinkers. Paano nagkakaroon ng gout ang mga mahilig uminom ng alcohol?
Alcohol, specifically beer, has a high uric acid content. And Doc Freddy, if you drink alcohol, you can also notice that while you're drinking, you urinate a lot. So there are two things that can cause the flares. So an increase in uric acid and decrease in the fluid can make the uric acid crystallize. That's why they have gout flares.
Now, Doc G, kapag ang isang tao ay mataas ang uric acid nila, nagpa-blood test sila, Although wala silang nararamdaman na pain sa joints, wala silang nararamdaman na masakit sa katawan, are these people considered to already have gout?
Not yet. They are only considered to have hyperuricemia. You are considered to have gout if you already have arthritis. Arthritis is swelling of the joints, so it has redness, tenderness, and pain. And it usually occurs in the big toe, as what Doc Dave said. No, it can also happen in other joints, but it is usually on the big toe on the first attack. It is also called as podagra.
Dr. Dave, aside from alcohol, specifically beer, aside from the high purine foods, are there any other things that people consume that are contributory to triggering a gouty attack?
People consuming maintenance medications for hypertension, like the diuretics, people who are dehydrated and not used to drinking lots of water, sometimes they had this gouty attack because they cannot get rid of the uric acid in the urine. So most of the time, it's a multifactorial disease. There's diet, there's the dehydration, and sometimes I see patients with high impact activities like basketball or jumping. Then when they had this trauma on the foot, sometimes they had this gouty attack because most of them are, it's either overweight or they have constant trauma to the feet or the knees, because the uric acid loves inflammation. So they tend to see that there's an inflamed area, so they will go there and have an inflammation. So there are many factors involved.
Can one of the factors, Dr. Dave, be sugar? Can people who are fond of sugar increase their uric acid?
Yes, of course. That's the fructose-containing substances like soft drinks, the soda, the fruit juices. Usually they contain fructose, which when you metabolize fructose, and it will convert into uric acid.
Now, gout flares start suddenly and can last days or even weeks. When we return, we'll talk about another type of arthritis, which is pseudogout, and its difference from common gout. This is MedTalk Health Talk, your partner in healthcare. I'm Dr. Freddy Gomez, and welcome back to MedTalk Health Talk, where caring is our calling. Now let's talk about a form of gout, which is called pseudogout. Dr. G, for those who are unfamiliar with pseudogout, please tell us what it is. Where does it happen mostly?
Pseudogout is a kind of arthritis that usually happens in patients who are 60 and above. And in contrast to gout, it usually occurs on the knee first, and it lasts longer. And the difference will usually be seen under the microscope. The type of crystal that causes the gout is calcium pyrophosphate.
With that, Dr. Dave, pag-usapan naman natin is what happens is, or what causes the most symptoms is the accumulation of these gouty crystals, these uric acid crystals in the joints. You mentioned earlier that the most common part that starts with this is the big toe, but it can also be felt in other joints as well. Let's talk about that. When will the crystals normally form, causing the more painful symptoms? Is this something that is reversible?
The symptoms usually is the patient usually comes in, there's a history of too much intake of alcohol, then alcohol contains uric acid. The patient will complain of swollen foot, that the uric acid likes to stay on small joints, so that's why it's in the big foot. And they also like to stay on colder places because the foot, the big foot or the big toe, it's usually colder because the circulation is the farthest from the heart. So the uric acid likes colder places, so they crystallize, then causing the swelling. The crystals, they are usually reversible if the patient is maintained on proper diet and maintenance medications to decrease blood uric acid levels. So it can be reversed.
Kapag umabot na sa punto where we have tophaceous gout, meron na tayong mga bukol sa iba't ibang portions because of the uric acid crystals, when does it happen, Dr. G? At what point is this something that can be prevented? When it does happen, what is the usual management?
So as you said, there are stages of gout. So first, it starts with hyperuricemia. So usually, this takes 10 years for you to develop gouty arthritis. And then when you have gouty arthritis, if you still haven't controlled your uric acid levels, the uric acid will continue to accumulate on the joints, which will cause tophaceous gout or tophi.
Dr. G, you mentioned stages of gout. Technically, there are around 4 stages of gout. At what point is, if someone has high uric acid in their blood, is this immediately, dapat ba gamot na kagad ang ibigay ito sa pasyente? At what point ang pwede pang diet and lifestyle modifications to alleviate any possibility of gout progressing?
In practice, if ever your uric acid becomes double digits, like 10 or 11, so that's when we already start medication. But if it's lower than that, diet can be tried first and also weight loss.
Now, Dr. Dave, typically, for the most part, ang gout is managed through medicine. Kayang idaan sa gamot most of the time. Meron bang punto na kailangan surgical intervention for some of the symptoms or treatment ng gout?
There are severe cases that the tophi or the nodules gets infected. So that's the most common indication for surgery. There's an infection on the joint. You remove the tophi or the infection. The other indication for surgery, it impedes function. So I'm a rehab specialist. When I see my patients who have this large tophi on the hands and on the elbows, which decreases the range of movement of the patient, I usually advise the patient to undergo surgery.
For those who are suffering from gout, could you describe what type of physical limitations they may have? Can they still do their daily, day-to-day activities or very limited sila because of this? We're trying to emphasize how important it is to prevent this from happening.
They can still have regular activities. We actually have athletes or basketball players who have gout. As long as we control the uric acid levels, they can live a normal life.
Now, Dr. G, pag-usapan natin yung common gamot para sa isang taong meron gout. So, a lot of people may be familiar with the medications being given. Please explain how the different medications function. At what stage of gout are they most effective?
The first one, the overproduction, that's the drugs that we have here in the Philippines. I know everybody knows this, allopurinol. It blocks the formation of uric acid. So it lowers the uric acid that is produced. That's why the uric acid level is controlled.
Coming up, we'll talk about tips on how to treat and manage your gout. Only here on MedTalk Health Talk. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, your partner in healthcare. So now let's continue to talk about the treatments for gout, or how to manage if you're diagnosed with gout. Dr. Dave, can you please share with us the common treatments for gout?
With gouty patients, follow-up is very important in order to monitor the blood uric acid levels in the blood. Most of the time, patient would self-medicate with anti-inflammatory drugs. Then you see them with kidney disease or the liver, so enzymes are increased. So follow-up is important to prevent exacerbation or the attacks of acute gout. Then you need to tell them to regularly check their blood chemistry, to check the liver enzymes, especially because allopurinol is not good for the liver. So you need to check them at least every 3 months to check the joints, to check the blood chemistry, and so you can titrate titrate or you can adjust the dose of the medications.
Are there any new studies when it comes to the treatment of gout, the management of gout, and how to manage the arthritis symptoms for that matter?
There are currently nothing new, but it's important to reiterate to patients that they have to do regular follow-ups because they have to work closely with their physician to fight off this gout and to control it. So like Doc Dave said, there are certain medications that you give for the attack. And then there's also something you give for prophylaxis so that you won't have recurrent gouty attacks. And there's something that you give to lower the uric acid level. So for the attacks, the acute attacks, you usually give this NSAIDs or non-steroidal anti-inflammatory drugs. And for prophylaxis, we usually give colchicine. And then to lower the uric acid, usually we give allopurinol and febuxostat if they're allergic to allopurinol.
Is there any advice that you could give, Dr. G, to those who are diagnosed with gout, some of the more low-cost ways in order for their quality of life to be improved?
We can also do exercise to have weight loss because weight loss also helps in the case of the uric acid levels. The available drugs, the allopurinol is actually already cheap. That's what we give so that they can sustain it.
Before we go, Dr. Dave, do you have any final tips for our viewers, especially when it comes to lifestyle modifications?
That you need to have a healthy lifestyle and you need to maintain it. You need to exercise, at least focus on the low impact exercises. You need to enjoy life because Filipinos, we love eating. So you should have a list of foods that you need to avoid in order to avoid the acute gout. Also, you need to hydrate properly. Avoid those soda, those sweetened drinks that can cause knee pain. And you need to follow up regularly, not just because you have the acute gout attack. You go to the doctor. You need to follow up regularly kahit walang pamamaga or walang nararamdaman. So you can monitor your blood chemistry, including the blood uric acid levels.
Thank you, Dr. Givenchy Marie Garcia Bonifacio and Dr. Dave De Castro for being with us today and sharing your tips and expertise about gout. I'm Dr. Freddy Gomez and thank you for watching MedTalk Health Talk. We'll see you again next time.